2018, the journal publication category at UPM, and was nominated for the Malaysia Academy Award in 2019 for the Journal Publications and Research Awards. In 2022, she was awarded the Excellent Women Award from the Malaysia Chinese Women Entrepreneurs Association, recognizing her extraordinary contributions to society and the community. Let us give a warm welcome to Dr. Chee for her presentations.
Thank you, Madam Uy, for the introductory of my CV. So, hi, good morning to all the audience who are attending this international scientific webinar. And today I'm going to share with everyone about the current trend on viral infections in Malaysia. But it's not just talk about in Malaysia. I will be sharing about some global informations on the viral infections. So do allow me to share my slide. Okay. So I hope everyone can see my slide clear. And now, of course, the first thing I would like to share, it will be on the infections, viral infections in Malaysia first. I think all of you that work in the lab, diagnostic lab, especially the infectious diagnostic lab, you should know more than me, okay? Because this is a Malaysia Diagnostic Lab. So in this case, I think currently what we receive the information from the KKM will be on the whether Mpox or monkeypox virus, the clade 1 has been in Malaysia, because the clade 1 is more virulent. We say that it's more virulent. But fortunate to say that in Malaysia, since 2023, we've seen 12 cases of Mpox disease, and all of them are from the clade 2. So on the right hand side, you will see that there is the distributions of the different clade 1 and clade 2 Mpox cases worldwide. So when you focus on the clade 1, which is more virulent, then you will see that it's focused in the Africa continent. But the rest of the continent basically are clade 2. So follow Mpox, of course, you will heard about the human metapneumo virus, which is spiked from the higher surge of cases detected in China. So during that time, I also received several media asking whether I can share some information on the human metapneumo virus. But unfortunately, that time I was not available. But it seems that when cases or any outbreak from China, everyone are very alert and putting high suspicious of whether this is a new viruses. So human metapneumovirus is not a new virus, and it has been always circulating in Malaysia, especially during the high transmissibles for the respiratory infectious diseases. So in 2024, as reported here, Malaysia recorded 327 human metapneumoviruses. However, this number, I would say that is those reported or those hospitalized and it's been detected in the lab. But those with mild symptom, usually they won't turn out, and then you will be miss the cases. So the cases definitely will be more than 327. So would there need to be is my mute? Are you able to hear me? Are you able to hear me? Yes, okay. Because someone told that, okay. So is it human metapneumoviruses is a bit need to be panicked? Actually, it's not. Yeah, because it's common, has been detected in occasionally in Malaysia. So like, for example, here, China, India, Malaysia, and Kazakhstan. So it's a very common respiratory viruses. And later on, we come to these waterborne diseases, which during the flood time in Kelantan end of last year, that you start to see there is an increase of waterborne diseases. This is due to the hygienic issue, and usually is to do with the shelter. So many people are living in a shelter and lacking of all the clean water, and that is why you will have this waterborne diseases outbreak in the shelter. So during that time, it's also recorded that 20 of the chickenpox and the 13 of the handfoot and mouth diseases was detected. So this is expected during the hard time, during the flood, because lack of clean water, and also you're unable to keep yourself hygienic due to a crowd of the stay in the shelter. So we talk about the waterborne diseases, then it comes into the food poisoning virus that can cause a food poisoning. Norovirus is very common, and it has been always in the outbreak, causing the outbreak. And I also been invited by media to talk about norovirus. Why? Because norovirus also has been detected as an outbreak in China. So anything to do with the China reported, and then the media will contact me already asking me, would you like to talk about this one? Do we need to be worried on this? I said norovirus is very common, yeah, and in Malaysia, in worldwide, so no need to worry unless the cases or the number of cases is increasing, then the public health authority need to take some actions. So in this case, it has been reported in last year in a private school, norovirus. And of course, the norovirus has been in our community. It will come and go. So norovirus in 2025, this year, is happening in the US. Why? Because of this wildfire. So because of wildfire, a lot of the residents have to be stay in a shelter. So if you start to see that many people staying in a shelter, you will see that there is a lack of all the clean water, and too many people are there, and usually they are unable to take their own proper food. So this will be the causes of the spread of the norovirus. And also there is Holland America cruise. This is also one of the major place that they will spread the norovirus, especially if the food handler, because usually you are in the cruise, you are actually contain yourself, and everyone has been living together for several of the days, so you will easily spread the virus throughout the whole journey. So sometimes you will see a lot of food poisoning happening during in the cruise. So in UK, they already start to you will see that end of last year, you will see that it's an increase of the norovirus cases. This is also to do with the winter time. Yeah, because winter time, everyone like to keep themselves and warm. So most of the time, they are unable to, for example, do a lot of cleaning. So that is the cause, that one of the reason that there is a spread of the norovirus during winter time. And this will be the estimated graph showing that along the time, you will start to see that peak will be at the February, March, and later on they will reduce. So this trend is being expected. This is in UK. So why people are worried about the norovirus during that time? This is because of the starting of the norovirus outbreak in China since October. So you can imagine, once China has reported certain outbreak, and then other countries will be worried about it, because these are the viruses that can be easily spread. If let's say for norovirus, if let's say you are not taking care of your hygiene. and also the food that you are taking in. So now after the food poisonings viruses, now we come to the another virus which is very common in Malaysia, worldwide as well. So it's the hand, foot and mouth disease. So in this graph, you will see that it's cases from 2015 up until May 2022. You will see the cases is up and down, yeah, especially during the COVID time. Why it's down, I think everyone knows, because hand, foot and mouth disease is spread in the preschool, usually preschool or the nursery. So during that time, lockdown, so no student go to school, everyone stay at home. So you will start to see that the cases is reducing. However, when we start again, lift up our MCO, then you start to see the cases is increasing. This is expected, yeah. And in 2000, this the graph shows that it's May until May 2022. Then in 2022 up until June, Malaysia recorded very high hand, foot and mouth cases. So more than 100,000 cases. So this is unusual, yeah, because half a year you start to see this one. So action need to be taken. So fortunately, our KKM have taken the actions, and also the nursery, the owner of the nursery or the whatever nursery that have these cases, they start to implement sanitations or disinfections on the whatever toys or surfaces that the children will touch on them. So in 2023, as reported here, I only can get the information up until May, and you start to see there is a reductions in terms of the cases compared to 2022, because 2022 is the highest, so we cannot make a comparison. More important is that the national already have an alert, because we do have the average national level for the alert, which is 722 cases for hand, foot and mouth disease per week. So during that time in May, from April 30th to May 6th, actually we recorded the 1,150, which is exceeding the average alert level. So that's why KKM have done something to alert all these nursery to really take care, look after, to be vigilant, so that we can reduce the cases. Or also remind the parents not to bring the kids that who are not well to go to the school. So these hand, foot and mouth diseases not just happening in Malaysia, it also happens in worldwide. I'm just giving you an example in Singapore, our neighbor. So you start to see that the cases is increasing in 2024. Yeah, 2024 in cases is increasing. So when you see the trend is worldwide, not just in Malaysia. And this is the cases in Japan as well, okay, in 2024. So the trend from different country will be the same, because this hand, foot and mouth disease can be spread very fast. Okay, so after hand, foot and mouth disease, now I would like to bring attention all the audience here to enterovirus. Maybe some of you have heard about the enterovirus D68, maybe some of you are not. So enteroviruses, usually you will say that, okay, they are causing the enterogastritis, but some of the enteroviruses, they are actually causing respiratory illness. So this study done by Prof. Chan Yok Fan groups, so they are looking at the seroepidemiology of the enterovirus D68 infections. Of course, you're saying that this is about 10 years ago, the samples about 10 years ago. But bear in mind, sample in 10 years ago not necessarily means that recently we don't have this infection, just that we are not detecting. It doesn't mean that they are not there. So from what the study here shows that the outbreak actually is correlate, not say correlate, is to do with one of the outbreak in US. So US have this outbreak, then Prof Chan group want to see that whether Malaysia have this virus circulating during the outbreak time. So that is why they have this study to look at the whether there's any enterovirus D68 circulating in Malaysia. So from this study, yes, it shows that enterovirus D68 actually circulating during this period of time when US have an outbreak of the enterovirus D68. Just that we are not detecting that. And other respiratory viruses, I have no need to share. I think everyone knows SARS-CoV-2, influenza are now actually picking up the cases. But what I would like to share is that usually in the cases to do with the respiratory viruses, you start to see in those temperate country, they usually will occur end of the year during winter time. So that is because winter time everyone stay indoor, hardly go outdoor, so easily spread influenza virus and COVID-19. And another one to bring attention will be the RSV, respiratory syncytial virus, which is picking up and not just infecting the pediatric patient, that children or kids, but they're also infecting the elderly. So right now they are looking for the prevalence to come up with the suggestions for vaccinations. So there is a vaccine available, and you will see that in the UK. So you will start to see there's a lot of infections, especially in the end of the year. You will start to see 2022 and 2023. This is to do with the year-end accumulations of the infections, especially on the respiratory viruses. Now, another virus that I would like to share will be the HIV. So in this graph, you will see that the numbers actually, I will say that I wouldn't say that it's fortunate, but we are glad to see that in 2010 years ago, the cases is actually increasing. However, I think we have done quite a good control in terms of the spread of the HIV. So you start to see that since 2019, the HIV cases is almost stagnant. Yeah, they're on and off. There was some increase, but you will see that they are still controllable. So hopefully this trend can remain. There's no increase, but maintain, because once you get the HIV, the virus is with you forever. Yeah. So, but in 2022, we have seen there is an increase in terms of the HIV cases. But hopefully this number is maintaining. There's no increase in 2024 and the coming years. So all these informations that I share is those that I think that is worth taking a note on this. So that's why I'm sharing. Another group of the viruses that I would like to share will be the vaccine preventable diseases. I think recently there is the outbreak of the measles virus. Yeah, measles virus. So early of this year, there is the measles outbreak, a mild outbreak in Sabah Penampang district, and it involved 45 cases, and then second epidemic week it will increase to 52. So an outbreak is actually, another outbreak was also reported in Kampong Limbana, which is involved 37 cases of epidemiological connecting to the case reported. And also because this measles is vaccine preventable, so that's why several doctors actually put out a letter. They say that we have to really do a proper childhood immunization to save life. So this, and also in a report in a report stated in Malaysia for this number of vaccine preventable diseases, which is in 2022, we also recorded in 209 measles cases in Malaysia. Well, of course, beside the measles virus, there is also a pertussis cases that's recorded, which is all can be prevented by immunization or vaccinations. So global measles cases actually has seen a surge in 2023. This is due to inadequate vaccine coverage. So inadequate vaccine coverage, you can put it into two major groups. One is because of they are lacking of access to the vaccines, especially in the low middle income country, or the country that have this conflict, war, conflict. So a lot of baby unable to access to the vaccines. But another one is the anti-vaxxer. Yeah, more and more parents are very reluctant to allow their kids being vaccinated. So this is also one of the reasons of the measles cases jump. So measles cases are rising. So what we can do, actually, we would like to promote the vaccinations and also equally distribute the vaccines to those middle income country, as well as the nations that are in a conflict or in war. So WHO actually announced earlier in 2024, there have been a 30-fold increase in measles cases between 2022 and 2023 across 41 countries. With the conflict in Gaza, in Ukraine, in Sudan, you will see that these cases in 2024 definitely is increasing because they are lacking of all the medical assistance. So this to share with you the top 10 country with measles outbreak. So you can see that this one is recorded from September 2023 to February 2024. You will start to see that actually all these country we will consider that are the low middle income country. Pakistan, Nigeria, the highest is that. This is not including those that are in the conflict zone, like Gaza, like Sudan, or is not recorded due to their reporting systems is not good during this hard time. But beside this measles outbreak in low middle income country, and including Philippines, we start to see that those high middle income country or the high income country also recording the measles outbreak. So this is likely due to, well, the cases, imported cases, or could be a local, which is due to insufficiency or there is no immunizations being given. And you start to see that beside Taiwan, like Australia also start to see there is the imported cases, which they claim that it could be from Vietnam. Yeah, the child is a Vietnamese child, but this need to be rectified. But the alert is there, you see, especially if let's say there is any imported cases, then it spread locally, which you don't have the herd immunity, meaning that most of the kids maybe in the high income country, due to the parents reluctant to allow the kids to go for vaccination, then you will start to see that high income country will have this measles outbreak. And another vaccine preventable, this one will be the rotavirus. So rotavirus, everyone knows that is related to the food poisoning, and it will be spread from fecal oral route. And rotavirus gastro, there's a research have done that rotavirus gastroenteritis create 15 million annual burden in Malaysia. So it's one of the quite important beside norovirus, rotavirus will be one of the food poisoning, virus causing food poisoning that need to be taken care. So this is just the news that reported last year in the rotavirus outbreak, and they claim or they blame on the diaper waste. Yeah, so it's a fecal oral route, the diaper waste that contaminated the park, and then it actually transmitted to the person, to those that who go to the park, especially when you are doing the water activity. So in UK, they also have recorded the rotavirus cases, and you will see that rotavirus are different from norovirus. So rotavirus actually it will reduce during the winter time, but it will increase during the summer time. So this is a difference in the case of UK, but in Malaysia, because we don't have winter or summer, so our cases is more onto the sporadic, or sometimes you will see, but it's not fixed into the different months or seasons. But seasons, it will be more onto the during flood time, especially if you have a shelter for all the victim from the flood. And then have you seen that during the flood in Kelantan last year, it's also recorded there is a chickenpox cases, 20 chickenpox cases. Chickenpox also can be prevented by vaccination. So you will see that more than this one is in US, more than 90% of the chickenpox cases in New York City outbreak among unvaccinated people. So that's why I was saying that, because all the high income country, basically kids are not vaccinated is due to the parents will not allow their kids to go for all these kind of unnecessary vaccinations. And there is also a chickenpox outbreak, which is also last year in Kerala. So it's recording the 6,744 cases with 9 deaths in 75 days. So chickenpox can be prevented by vaccination. That's why we will need to promote all this one, because beside that you are suffering of the chickenpox, but it can cause the death. So this is worth for us to note on the consequences of not giving the vaccines to the children. Another vaccine preventable virus infection, it will be a polio virus. So in last year, 2024, you will start to see the outbreak in those, I would say that those under the conflict, like Gaza Strip, or in here they don't put the Sudan. I think Sudan will also have, and these are all the low middle income country. So in terms of their economy or their country to support the national immunization program is lacking, or they are unable to get sufficient vaccines from the other country in order to save life of their children. Okay, so beside the vaccine preventable disease, now I would like to share on some informations on the zoonotic diseases. So this report is in year 2020, which is before the COVID-19 pandemic. So during that time, they also already reported that 1 out of 4 people on the planet is actually affected by zoonotic diseases. And when you look at the global death in before 2000, this one before 2020, because this report is like they collect the information before 2020, and you will start to see that zoonosis diseases actually double of the death due to car accident and also diabetes. So zoonotic diseases is our major enemy, a human major enemy. And they found out that 75% of the newly emerging infectious diseases are zoonosis from either from our domestic animal or from wildlife. Yeah, and 60% of the infectious diseases in human are spread from animal. So during that time, before 2020, zoonotic diseases are responsible for an estimated 2.5 billion cases of illness and 2.7 million deaths worldwide. With the COVID-19 pandemic, definitely this figure increased. And I have the information from the website because since last year, April 2024, the WHO have not really collecting the data in terms of the death or the cases of SARS-CoV-2 or the COVID-19, and the recorded death up until April 2024 is already 7.5 million. Okay, 7.5 million. So you will start to see that including the SARS-CoV-2 or COVID-19, this more than 10 million deaths worldwide. And of course, recently we have news to talk about the H1N1 influenza, avian influenza. There's researcher and also a country that found that the virus is not just circulating in the avian, but it's also actually infecting the bovine, the cow. So you start to see that there is the numbers of all the poultry that affected, and how many of them have reported the outbreak. This is in this information is from US, and this bring alert to all the farmers. Yeah, because there's a farmer that actually be infected from the cow to the human, and not just from the avian, but it's also from the bovine. So from this is all the news that's talking about the human infections. A second human cases of bird flu in America is rising the alarm, and Australia also recorded the first human cases and traveling back from India. And there's a research showing that actually raw milk, that means raw cow milk, is not pasteurized milk containing the bird flu virus can infect the mice. So they are worried that by drinking the milk, you actually able to transmit the virus. But that's why WHO actually call for stronger surveillance of H1N1 bird flu among animals. And if let's say this is the summary of the H1N1 in human infections, 900 cases, 900 human cases reported in 24 countries. And since March 2024, there is a recorder of a first cow to human transmissions of H5N1 in United States. Yeah, so I hope that this is not going to become human to human transmissions, because when you talk about avian poultry, you will say that the animal kingdom is slightly lower than human. Maybe our genetic pool, genetic build-up is different, but cow is slightly closer to human. Yeah, so you will see that the virus is actually jumping from a species to another species, and I really wish that the H1N1 or the bird flu will not be spreading among the humans. If spreading among the human, then you will be just like another pandemic like COVID-19. Okay, another virus that need to draw attention from Malaysian is the Nipah virus. I think to Malaysian, Nipah virus is not new. Everyone, maybe not all knows about Nipah virus, but Nipah virus was first detected from in Malaysia due to the outbreak in this Kampung Nipah, Kampung Sungai Nipah in Port Dickson, among the pig farmer. So since then, Nipah actually has been detected in several countries like India, Bangladesh, Pakistan, and it start to see that Nipah virus flare up in Kerala again. So Nipah virus is there, but Malaysians have not experienced a second Nipah virus outbreak. However, one of the research study by also Malaysia, by Dr. Chang, they start to go into the Aborigines squatters, orang asli, squatters, to take their blood because they are the most closely related to the jungle, which is their ways interact, not say interact, but you will have a lot of bears in their squatter. So she went to the several Aborigines villages to collect the serum, and she performed the seroprevalence study. They do find that several of the villages actually has this Nipah virus antibody, meaning that they has been exposed to Nipah virus. Maybe they are not causing an outbreak, or they are very mild outbreak, it's just that it's not notified. That is the Nipah virus, which we also need to put on an eyes on. And second one is a Marburg virus. So Marburg virus Rwanda have recorded 7 cases of this Marburg virus. And why we are worried about this, because the fatality rate is high. So this is type of the hemorrhagic fever virus, which is causing the hemorrhagic. And usually now the Marburg virus is circulating in the Africa continent. And yesterday I received an update that is Tanzania from WHO. Tanzania have confirmed that is the first case of Marburg virus. So the virus is actually spreading. Though spread in the Africa doesn't mean that it will not spread to Malaysia. So we need to be stay vigilant to watch out of this. And of course, in 2023, I can't find the 2024 informations. During that time, our Ministry of Health, Minister of Health mentions that there is no Marburg virus disease detected in Malaysia. But you know, whether it was spread, and sometimes if let's say we are not really putting on the surveillance system, then we won't be able to detect any potential harmful virus. So beside the zoonotic diseases, and then we come to the arboviruses. Dengue, I think everyone's very familiar in Malaysia, so I'm not going to talk about it, but dengue cases has been raising recently, and is spreading to those temperate country. So you start to see that the temperate country, you will start to have the infections, the cases. It can be imported, or it can be there is a dengue, there is a dengue vector, which is Aedes in that country. So that's why you will see that there is a spread. And another virus, which is when I heard it, I said, wow, what is this virus? I never heard about this virus before, but it has been in the top line of the media since last year. Is called oral pox virus. So oral pox virus is actually a virus that is transmitted by an insect. Yeah, it's an insect, and which it's just like mosquito, it will bite and then it will transmit the virus. So oral pox virus, I don't know how many of you have heard about this. It's also in the alert system in WHO, also provide the alert to watch out for this oral pox virus. Okay, so another virus, I don't know how many of you have heard about Geta virus. So Geta virus also been identified in Malaysia in 1955, which is isolated from mosquito, and studied by a group from Prof. Zazali Abu Bakar and the Universiti Malaysia. They also find out there's a different group of the Geta virus from the mosquito. So and then they also another group study, this is a long time ago in 1980s. There is the serological evidence of human infections, the alpha virus. This Geta virus belongs to the alpha virus. And then you start to see that these viruses, not just from the QLEX, but they also actually It can be transmitted by Anopheles, Aedes some more. So since Malaysia have Aedes, we have Anopheles, we have Culex. So there's a possibility that this virus will be spread from the jungle and from the jungle to the animal and also maybe to the human. So why I want to highlight this Gata virus? So usually Gata virus is a disease burden in the livestock. Yeah, we know that when the virus from the livestock, they will mutate. Okay, this virus will mutate when they are replicates. So when they are replicating, they mutate in one day. We do not know when the genetic pool will changed. They will have a mutation. Then it may cause that the virus able to infect human. So we do not know. So we have to watch out on this virus as well, since it has been detected in Malaysia. So what will be, we talk about all these viruses, infections, then what will be the current preventions and treatments? So WHO actually identified 17 pathogens as top priority for new vaccine development. These 17 pathogens include malaria, include bacteria, but the arrow that's pointing here is to show that that is the for the virus. So pathogen where vaccine research is needed is hepatitis C and HIV. And then for CMV, influenza, which is looking at the broad protective vaccine, yeah, pan influenza, not just the circulating influenza, but it can prevent the future or the mutated influenza and norovirus. We have the rotavirus vaccine, but we don't have the norovirus vaccine. So pathogen where vaccine need to be further developed are all these three. And pathogen where vaccine are approaching regulatory approval. Dengue virus, we have the vaccine here. Is you can get the dengue virus vaccine in Malaysia. And the other one, as I said, RSV, you also can get the vaccine for the RSV. And there is a market survey looking at the market value of this vaccine, yeah, for viral and also bacterial infection is up to 69.21 billion in 2025. So this is a market value. And for anti-drug, okay, treatment for virus, the virus infection, vaccine is for prevention. So antiviral drug worldwide worth the market, USD 52.19 billion. So it's a huge a market there. So those who are in research of vaccines and antiviral, you can look at this list, 17 pathogens list that WHO have identified as a top priority. So are we able to prevent the next pandemic? So now in January 25, there is a publication on the global wastewater surveillance. So we do surveillance, and when we start we do wastewater surveillance for polio, but due to the COVID-19 pandemic, and some of the country have already started the wastewater surveillance for any potential pathogens. So Singapore have done, and Malaysia, of course, but some other country, that high income country, they are really working on the global wastewater surveillance, so that to give an alert to all the globe. And okay, I think this one will be the second last of my slide. So the Disease Acts, WHO actually have pointed out that that will be a disease X which we need to watch out, and WHO have listed 9 pathogens researchers are keeping on eye on this. So of course, COVID-19, the Crimean Congo hemorrhagic fever, Ebola also causing hemorrhagic fever, Marburg also causing hemorrhagic fever, Lassa fever also causing hemorrhagic fever. So you will see that these are major diseases that virus infections are caused the hemorrhagic fever with high fatality rate, and a group of coronaviruses, yeah, SARS and also MERS-CoV, and the other one is the Nipah, yeah, Nipah virus. As I said, Aborigines seroprevalence has shows that they have been exposed to Nipah virus, meaning that Nipah virus is still in Malaysia. Do not know when they're going to come out to cause the outbreak. So Nipah virus vaccines is really need to be there's need a group of researchers to work on the Nipah virus vaccine. Rift Valley River, of course, fever we don't have, Zika, and the other one is the disease X, which we do not know what is that. It could be SARS-CoV-3, SARS-CoV-4, and so forth and so on. But all the researchers actually postulated that it could be another outbreak due to the coronavirus. So WHO actually continue talk to prepare the world for next pandemic. So now Mpox is circulating, Marburg virus have outbreak, H5N1 is spreading. So the next pandemic is very soon. So we can't wait. We have to work together to combat this potential disease X. And if you want to get informations of the global infectious disease update, you can actually go into this website and then you can sign up their email alert. They will provide you, they will send you an email alert on the pathogen that you are selecting. So you will get a more up-to-date global infectious disease update, especially for the outbreak. So with this, I would like to say thank you to all the participants who spare your time listening to my sharing. I pass back to Madam Uy.
Okay, thank you, Dr. Chee, for the very comprehensive and very excellent topics. So now we'll know that wow, our surrounding is full with the virus. So and a lot of type of the viruses. So yeah, I can't see any. So now is due to the straight of the times. So let us jump straightly to the questions. So the participants, so if got any questions, you can put the question in the chat box also can. Is it no questions?
Everyone understand about the viruses that is circulating in Malaysia and also worldwide. So the virus is not here in Malaysia doesn't mean that they are not here. Just that could be our surveillance system is not picking up them, or we are not focusing on that surveillance for that particular.
Okay, there's one question from the chat box. Good morning, doctors. What will be our measures to keep ourselves not getting infected?
You need to be vigilant to how to say to interact with your whatever that you are interacting, the friends or whatever, to look at their symptom. If let's say there was some skin infections, you better give them advice to stay at home. And at the same time, we have to keep for those food poisoning. I think those that can be controlled, like food poisoning, we know that we have to select the restaurant with a good hygienic restaurant rather than you spending time in those not licensed store. So that is a food poisoning. And for hand, foot and mouth disease, of course, it's all to the children. It's better that you keep your child, if let's say your child is not feeling well, to keep at home. And another one is to have the complete vaccinations, the up-to-date vaccinations. And lastly is to build up your own immune system. So living in a healthy living style. This is what I can say. Yeah. So there is another questions. What is my opinion about the outbreak in China? No, it's not severe because it's a common virus. The doctor know how to treat the patients. It's not like COVID. COVID, we don't have the treatment. When there's an outbreak, we don't have the treatment. We do know this virus, so it will take some time for us to understand it and implement certain preventions. But human metapneumovirus is common to worldwide, global, so no need to worry about that.
Dr. Chee, I got one question from my side also because I'm the biochemistry. I just would like to know more clearly about how the WHO classify all these kind of viruses. It means that how they name the virus. Is it based on the geography or is it based on any genetic testing?
Okay, so for previously before 2015, the owner, not the owner lah, the scientist or whoever discover a new virus, they usually name on the place where the virus been first isolated or the scene. They will name the place or an animal that the virus has been isolated. But after 2015, WHO actually put this rule and regulation to name the virus basically based on the symptom. Based on the symptom they cause. Like for example, SARS-CoV-2. Why we cannot say it's a Wuhan virus? You cannot name the country or you cannot name the place that the virus been isolated. So you name according to the symptom, because this virus cause severe acute respiratory syndrome, so it's called SARS. And previously there is a SARS-CoV-1, COVID is coronavirus, so which is happening in 2003, also spread from China to Hong Kong and worldwide. But that different from SARS-CoV-2, because that SARS-CoV-1 during that time, the virus will be spread when you have symptom. So usually when you have symptom, you will isolate yourself or you will not go and mix around. But for SARS-CoV-2, basically it can be spread before the symptom appear. So that's why SARS-CoV-2 has spread throughout the world so fast compared to the SARS-CoV-1. Yeah.
Okay, thank you, Dr. Chee. There's a few questions from the chat box. Okay, from City, Prof, what is your opinion on the latest undiagnosed disease at the Democratic Republic of the Congo? Congo.
Okay, when you talk about undiagnosed disease, is sometimes it's to do with the facilities that in Congo. Yeah, in facility in Congo. So these informations I don't have, so I can't make much comment on this. I'm so sorry for this. Yeah, but usually all these country, the WHO will go in and they will deploy people, expert to go in to investigate. It may take some times. Yeah, pass to
another question. Good morning, doctor. Due to a rising issue of anti-vaccine movement, what do you think about this?
So that is why those that vaccine preventable diseases, it will be picking up, like measles, like chickenpox, COVID-19 has been so many anti-vaxxers there, but now you start to see those can actually preventable, especially childhood viruses. So I would say that all these viruses eventually we can get rid of it, like smallpox. In 1980, WHO declared world free of smallpox. So that is a successful of the vaccination to get rid of the smallpox. But because due to now currently a lot of people getting a lot of information from the media, social media, or they are more educated, they start to understand that here and there, they put in their own mind, so they start to have this movement, anti-vaxxer movement. So definitely chickenpox, measles, and MMR, mumps, measles, rubella, and pertussis, all these will increase, the cases will increase. This is definitely. Another one is to combat, or this one is to find out with to come up with the antiviral. So maybe parents are more reluctant to take vaccine, but if you have any antiviral drug, once their kids have come down with this disease, then you use the antiviral for treatment, maybe they will accept. So antiviral research, those who are interested, you can contact me for collaboration. Yeah, we?
Okay, another question. How far are we prepared for the viral outbreak in Malaysia? How well our system in terms of diagnostic and primary care to face the future outbreak?
Okay, because I'm not from the primary care specialist, I'm the scientist. Maybe some of you that you are in the primary care can provide some support by answering these questions. But definitely, when you talk about those that are reported, we already have the diagnostic tests like dengue, all this doesn't have any issue. It's only those that is not common to Malaysia, and we don't have. I don't know whether all the primary care clinic have that test kit. Most of the time, you have to go to the MKK, correct? MKK or IMR for these spacious or rare detections of the viral outbreak. But Nipah virus need to watch out. This is I would like to mention because seroprevalence indicating that the aborigine have the antibody. So Nipah virus, it should be watching out on that to let all the primary care specialists knows about this the symptoms of the Nipah virus infection.
Okay, another question. May I know how do we know either the virus was wild virus outbreak or based on the created in the lab?
This one I can't tell you, but usually they have to go back to the genetic profile. So usually they have to do the whole genome sequencing to get the sequence of the virus and check back those that virus strain in the lab that they have if let's say they are reported regulation, they regulate and then they reported, then you have to make a comparison in terms of the genetic. So this is the only way that we can know that whether it's from the wild or it's from actually created in the lab.
Okay, another question. Prof, what is your opinion on the main challenge to Malaysia in preparedness on the disease X predictions?
The main challenge actually is the resources. I would say that resources. Yeah, resources and also the knowledge, and then another one is the collaborations between the different ministry is very important, because what we'll see is that another pandemic, it could be from animal. So we have to approach this we have to have this One Health approach, which is closely working together among the animal sector and the human sector, also the environment, and not just these three ministry, and it include the researcher from the university, that we have to work together towards to achieve to get ourselves to prepare ourselves for the next pandemic.
This is the last question. What is the current virus you're working with? What is the significance with our country?
The current virus I'm working is, as I said, my primary research is on dengue. So currently I'm looking at the AGE, because dengue causes antibody-dependent enhancement, and we are looking into the potential of different virulent genes, which is we call quasi-species genetic diversity in the same patient. How this virus actually mutate in the same patients, and study whether these patients have the more severe symptom.
Prof. Chee, is the last question for myself. I just want to ask regarding to the rapid test kits, it's how efficient the rapid test kit can detect the viruses, because normally like I bring my kids to the, because all the virus show the same similar symptoms, sign and symptom. So like for example, I bring my kids to the GP, sometimes they ask me to test this kit, that kit, then sometimes they don't know how to treat. But if my kid is like how many days already fever but still can't recover, so sometimes they on two antibiotic and antivirus together.
Yeah, this one doctor they will look at the symptom, because different viruses they will have some symptoms slightly different. But of course, some of the virus infections you are unable to differentiate the symptom. But usually bacteria and viral infection is quite easy to doctor they will know that how to differentiate these two. But when you talk about rapid test kit, definitely rapid test kit is just a preliminary screening step. Yeah, then you must have the high viral load, then only you were able to detect, especially you are detecting the antigen. If you are detecting antibody, usually you have to have a fever 5 or 7 days. Then your body develop the antibody, then you're able to develop to detect it. So based on if let's say early symptom, usually we detect the antigen, either detecting the rapid test kit usually detect the protein, okay, the viral protein. So you need to have a higher yield, then only you were able to detect it positive. So if let's say the doctor say that after you bring your kids to the GP and they have tested everything is all show up negative, it could be it's too early. And then all of us know that rapid test kit, their sensitivity is low compared to like PCR or real-time PCR. So if let's say you are suspecting and then your kids is not recovering, perhaps you can consider to propose that you want to detect the genetic material, okay? Or usually all this one will be if your kid is how to say it, is the hospitalized, then only they will go into the molecular detection. And then it's not all the government hospital will have this molecular detection for some of the viruses. So usually private hospital, they will have, but you have to pay for yourself. It's quite expensive.
Okay, thank you very much, Prof. So got any questions? No. Okay, there's a link for the attendance at the chat box. So fill in the link for the attendance. So everyone, is it we would like to have a photography sessions. Is it anybody can on the cameras and we take a photo? Oh, there's somebody raise hands.
Me ask what is my opinion if the clinician still need the IgG. So this referring IgG referring to dengue or what? Dengue because IgG they are indicating as a secondary infection. So there is a issue of AD, antibody dependent enhancement. So that's why the clinician would like to know whether this patient has been exposed to dengue before. If yes, then they need to watch out with this potential ADE. So currently my lab is doing this one. We are checking on the potentials a marker to indicate that this patient may have a tendency to go to have this AD, antibody dependent enhancement.
Prof, may I ask related to this question? I'm Zohaimi. Okay. What is your opinion based on rapid test for dengue in the market? There are many of rapid tests for the dengue kits. Okay. So some hospital they only use for rapid test for diagnose dengue. But some other hospital they use the ELISA method for diagnosis. And some hospital they do both. So what is the best algorithm that your opinion to be applied for these three lab if they have this practice?
Okay,
First, they have both. Second, they only have one ELISA method. And the third is they only have rapid. Okay, because somehow when we send the result to the clinician, they have some sort like a patient punya ni lah.
Yeah, sometimes it need to look at the symptoms lah. For example, if you rapid test kit is for the first line screening. Okay, first line screening just to quickly understand what disease this patient is infected. But the sensitivity, as I mentioned, the sensitivity is lower compared to EIA. So, and then the dengue, it only let you know yes or no. Rapid test kit, yes or no. But EIA, they give you some title. So it depends on the facilities in the lab. But if let's say the facilities in the lab, they don't have the EIA, then they can use the rapid test kit as their first line screening. When they are suspected something, suspect dengue, but they are not detecting dengue, then perhaps they will suspect it could be due to low antibody or any others, then they will go for higher, more sensitive method, which is EIA. So you cannot see that which algorithm is the best. It's just that when there is a need from the doctor.
Okay, thank you, Prof.
So, got any question? Okay, so there's no question. Is it possible for us to take a photo sessions together? Can anyone just on the camera?
I think maybe some of them are shy to on the camera.
Now we end our sessions now. So thank you very much of the attend these seminars. So thank you very much, Prof, for the very interesting topics.
Thank you, everyone.